ऑल फ्रेंड्स, उम्मीद है आप सब खैर खैरियत से होंगे। आज की इस वीडियो में हम एक नहायत इम्पोर्टेंट टॉपिक के बारे में डिस्कस करने जा रहे हैं। अलाइड हेल्थ प्रोफेशनल काउंसिल पाकिस्तान ने मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट के हवाले से स्कोप ऑफ प्रैक्टिस इशू किया है। आज हम इसके बारे में डिस्कशन करेंगे। अलाइड हेल्थ प्रोफेशनल काउंसिल पाकिस्तान ने जो स्कोप ऑफ प्रैक्टिस जारी किया है मेडिकल लेबॉर्ट्री प्रोफेशनल्स के लिए, उसमें सबसे पहले मेडिकल लेबॉर्ट्री असिस्टेंट आता है, दूसरे नंबर पर मेडिकल लेबॉर्ट्री टेक्नीशियन है, तीसरे नंबर पर एसोसिएट मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट के लिए स्कोप ऑफ प्रैक्टिस है। उसके बाद मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट जो प्रोफेशनल हैं उनके लिए है। उसके बाद स्पेशलाइज्ड मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट हैं और मेडिकल लेबॉर्ट्री साइंटिस्ट हैं। उसके बाद ऑथराइजेशन फॉर द प्राइवेट लेबॉर्ट्री, यानी कि जैसे कि आपने अपनी प्राइवेट लेबॉर्ट्री ओपन करनी है तो उसके हवाले से स्कोप ऑफ प्रैक्टिस अलाइड हेल्थ प्रोफेशनल काउंसिल पाकिस्तान ने जारी कर दिया है। सबसे पहले हम इसके इंट्रोडक्शन की बात करते हैं। मेडिकल लेबॉर्ट्री टेक्नोलॉजी इज़ द इसेंशियल अलाइड हेल्थ डिसिप्लिन दैट सपोर्ट द क्लिनिकल डिसीजन making through the accurate, reliable and timely laboratory diagnosis. Medical laboratory professionals are non-clinical healthcare professionals who perform laboratory investigation on the biological specimen in accordance with the approved standard protocols and quality system. Their role is central to ensuring the quality laboratory services, patient safety and effective healthcare delivery. The document defines the scope of practice of the professional educated and the trained in MLT, outlining the roles, responsibilities, competencies and the professional boundaries of the MLT professional at various qualification level. The scope is structured according to the educational credential, training standards, experience, and it applies the medical laboratory assistant, technicians, associate medical laboratory technologist, medical laboratory technologist, specialized medical laboratory technologist, and medical laboratory scientists. The scope of practice described here in the design to ensure the standard, ethical, and the competency-based laboratory services in compliance with the national regulatory framework. It emphasizes the adherence to approve the standard operating procedures, SOPs, quality control and the quality assurance system, biosafety practice and the accreditation requirements. This document also clarifies professional limitation, reportedly authority, supervisory role, academic responsibility and the eligibility for the independent laboratory operation in accordance with the approved regulatory and the accreditation standard. The scope of practice outlined herein shall be binding and enforceable, ensuring the standard laboratory services, patient safety, quality assurance and the compliance with the national regulatory accreditation and the ethical requirements. सबसे पहले हम स्कोप ऑफ प्रैक्टिस की बात करेंगे लेबॉर्ट्री असिस्टेंट के हवाले से। उनकी एलिजिबिलिटी है सेकेंडरी स्कूल सर्टिफिकेट with a 1 year certificate as a medical laboratory assistant from an AHPC Allied Health Professional Council Accreditation Institute. स्कोप में आ जाता है सबसे पहले the AHPC registration is mandatory to assist the laboratory technician to perform all routine cleanliness of a lab working area and the equipment daily. Sample preparation including sorting out, centrifugation for routine lab work, sorting out samples having pre-analytical errors to avoid the wastage of resources, to assist in record keeping and maintenance of the laboratory, to assist in coordination activities between the lab technician and management, to ensure the patient compliance can be placed as a phlebotomist, receptionist if eligible based on the expertise training certificate, to assist in the inventory management via the lab store, to maintain sample storage for the reassessment and record, to manage the sample handling and transport if required, to assist in the reagent preparation, data management, and quality assurance activities with waste management and stock management. Next है, the scope of practice shall be applied exclusively to existing certificate holder. No institution is authorized to initiate or offer this program. Furthermore, it is hereby advised that any institution currently offering the 1 year certificate program must ensure its discontinuation no later than December 2030. नेक्स्ट जो स्कोप ऑफ प्रैक्टिस अलाइड हेल्थ प्रोफेशनल काउंसिल की तरफ से जारी किया गया है वो है मेडिकल लेबॉर्ट्री टेक्नीशियन के लिए। उसके लिए जो एलिजिबिलिटी है वो 2 years डिप्लोमा है विद हायर सेकेंडरी स्कूल सर्टिफिकेट इन MLT फ्रॉम द रिकॉग्नाइज्ड इंस्टीट्यूट हैविंग AHPC accreditation. IBCC equivalence is mandatory if required. स्कोप में है AHPC रजिस्ट्रेशन मैंडेटरी, assist a medical laboratory technologist, perform all routine examination and also special examination for 5 years of experience, responsible for routine daily maintenance, cleanliness and the inventory control to ensure the patient compliance, to prepare all lab reagent sample if required and other chemical need preparation, to run quality controls and maintain record of all lab activities, can initiate incident report, can act as the phlebotomist if required, supervise daily maintenance and the cleanliness of analyzer and the equipment, maintain daily logs and the troubleshoot, supervise junior technical staff, supervise inventory and storage activities of a lab daily, ensure waste management and disposal, apply a relevant standard operating procedures and work instructions is needed. उसके बाद जो स्कोप ऑफ प्रैक्टिस है वो है एसोसिएट मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट के लिए, जिसके लिए एलिजिबिलिटी है BSc 2 years in MLT from the recognized institute having AHPC accreditation. HEC equivalency is mandatory if required. Scope of practice में है AHPC registration mandatory. Assist medical laboratory technologist, can act as a assistant lab manager, assistant quality control manager, assistant human resource manager if required, manage human resources in lab, perform all specialized analysis if required, ensure smooth lab workflow, to perform QC quality assurance, to ensure total quality management in lab, perform periodic performance maintenance activities, manage accreditation and certification activities in the lab, coordinate technical training of lab staff, coordinate career and technical education activities including workshops, seminars, hand-on trainings and demonstrations, manage stock, inventory, human resource, waste disposal, workflow data and management and information system, can issue reports of routine analysis with clinical assessment, prepare and implement all SOPs and the work instructions as needed, coordinate with lab management and hospital management and clinical facilities as needed, perform all purchase and procurement related activities. This scope of practice shall exclusively applying on existing BSc MLT degree holders. No institution is authorized to initiate और ऑफर एनी टाइप ऑफ 2 years डिग्री प्रोग्राम. उसके बाद है मेडिकल लेबॉर्ट्री टेक्नोलॉजिस्ट. एलिजिबिलिटी है BS MLT 16 year एजुकेशन, BSc MLT 14 years of education with MSc in MLT histopathology, cytopathology, hematology, clinical chemistry and biochemistry, medical microbiology, medical virology, medical molecular biology, biotechnology or relevant education in the field of MLT from the recognized institute having AHPC accreditation. Higher Education Commission equivalence is mandatory if required. स्कोप ऑफ प्रैक्टिस में है AHPC की रजिस्ट्रेशन जो है वो मैंडेटरी है. असिस्ट लेबॉर्ट्री मैनेजमेंट कैन एक्ट एज असिस्टेंट मेडिकल लेबॉर्ट्री मैनेजमेंट, असिस्टेंट QC मैनेजर, assistant HR manager, manage human resource in the lab, perform all specialized analysis if required, ensure the smooth lab workflow, perform QC and QA to ensure total quality management in lab, perform periodic performance maintenance activities, manage accreditation and certification activities in the lab. ISO, CAP, JCIA, Healthcare Commission, manage technical training of lab staff, arrange CTE activities including workshops, seminars, hands-on training and demonstration. Arrange advanced update technical training in the lab, manage stock inventory, human resource, waste disposal, workflow data management, business development and information system, can issue reports without clinical assessment, can establish a basic lab testing facility, independent blood bank and collection point with limited test facilities except cytopathology, human histochemistry, histopathological and bone marrow reports as prescribed by the AHPC. MPhil is in any relevant field of MLT is required, can establish a highly equipped indigenous laboratory facility with all routine, a special analytical facility with the relevant reporting authority, a PhD in any of the relevant fields of MLT is required, prepare and implement all policies, SOPs and work instructions as needed, monitor all accreditations and the certifications relevant to diagnostic lab, coordinate with the lab management, hospital management and the clinical facilities as needed, perform all purchase and procurement related activities, will act as a discipline in charge in classroom management team, teaching undergraduate students, assist in the development of the curriculum and course materials, conducting assessment and examination, assisting higher faculty member in monitoring, mentoring and advising student. उसके बाद है जी assistance in the conducting collaborative research in the relevant field of allied health sciences, publishing in the peer-reviewed journals and presenting at a conference, assisting in the accreditation process, contributing to the policy making within the department, organizing workshops, seminars and the outreach programs, engaging in community education to stay updated with the advances in the allied health sciences, attending the workshops, seminars and training programs, can conduct an ISO 9001 and ISO 15189 ordered after the relevant certification and training. उसके बाद है जी specialized medical laboratory technologist eligibility criteria, scope of practice for the medical laboratory technologist having higher qualification MPhil and PhD. बेसिक जो एलिजिबिलिटी है उसमें बेसिक क्वालिफिकेशंस में है BS MLT 16 year education and BSc MLT 14 year education with the MSc in MLT, histopathology, cytopathology, hematology, clinical chemistry and biochemistry, medical microbiology, medical virology, medical molecular biology, biotechnology and the relevant qualification with 5 years relevant experience in the field of MLT. हायर क्वालिफिकेशन में है जी MS MPhil इन दी MLT MLS हिस्टोपैथोलॉजी, साइटोपैथोलॉजी, हेमाटोलॉजी, क्लिनिकल केमिस्ट्री एंड बायोकेमिस्ट्री, मेडिकल माइक्रोलॉजी, microbiology, medical virology, medical molecular biology, biotechnology, or relevant qualification in the field of MLT registration. AHPC registration is mandatory. Will act as a laboratory manager, section supervisor, lead specific unit or section within the respective department, provide advanced clinical supervision and the mentorship in the training labs or the affiliated hospitals, participating in the clinical training of the student, new technologists and technicians, lead case discussion and clinical rounds, evidence based practice sessions, contribute to the clinical guidelines development and protocol improvement, maintain license or certification for the clinical practice where required, service as a coordinator or the head of the specific academic program and or committees, participate in the strategic planning and policy making with the department or school, assist in the accreditation, quality assurance and academic audit, engage in national and international collaborations, contribute to the community health initiatives or the interdisciplinary projects, develop, update, and implement SOPs and protocols, providing patient care or clinical services if the institution permits, faculty practice, staying current with the clinical best practices, ensuring the evidence-based education, ensure the compliance with the laboratory accreditation standard ISO 15189, CAP, NAQAP, and etc. specific to their specialty, oversees oversee oversee comprehensive quality insurance program for the respective specialty, reviews and the co-signs with chief consultant, can establish independent lab facility, independent or the hospital blood bank and the collection point with the limited test facilities except cytopathology, flow cytometry, immunohistochemistry, histopathological and bone marrow reports as prescribed by the AHPC, develop, update, and implement standard operating procedures and protocols, will act as a discipline in charge course coordinator, teaching undergraduate or postgraduate students, developing curriculum and course materials, supervise student project, clinical practice and internship thesis, conducting assessment and examination, mentoring and advising student, conducting independent and collaborative research in the relevant field of allied health sciences, publishing in peer-reviewed journals, and presenting at conference, applying for the research grants and funding, guiding students and junior faculty research product, participating in the departmental meeting, curriculum development and assisting accreditation process, contributing in policy making with the main department, organizing workshop, seminars and the outreach program. इसके बाद है जी engaging in the continuing education to stay update with the advances in the AHS, attending workshops, seminars and training programs, participated in the clinical trials and can eventually become a principal investigator or lead clinical research study with the relevant experience and training required. उसके बाद छठे नंबर पे है मेडिकल लेबॉर्ट्री साइंटिस्ट। क्वालिफ़िकेशन जो इसके लिए है, बेसिक क्वालिफ़िकेशन बिल्कुल उसी तरह BS MLT 16 ईयर एजुकेशन, और उसके बाद सारा जिस तरह पीछे जो है ना वो एक्सप्लेन किया गया है। उसके बाद है हायर क्वालिफ़िकेशन में PhD रिक्वायर्ड होती है 18 ईयर एजुकेशन के बाद, और उसी तरह जिस तरह पहले मैंने एक्सप्लेन किया है इसकी स्कोप ऑफ प्रैक्टिस में है कैन एक्ट एज ए HOD टेक्निकल domain, supervise day by day operations of the clinical laboratories, oversee compliance with the quality control, safety and accreditation standard, ensure the implementation of good clinical laboratory practice, and lead and train junior technologist, technician, intern, design and interpret complex laboratory tests and clinical chemistry, hematology, microbiology, molecular diagnostic etc, correlate lab results with the clinical condition, innovate and validate the new diagnostic methods, participate in the institution policy making and related to the lab services, contribute to national and regional guidelines for the laboratory operations, lead quality improvement initiatives, prepare labs for ISO 15189 CAP or national accreditation, conduct internal audit and proficiency testing, collaborate with the collaborate with the clinicians, head of department, managing director, pathologists, researchers, and the public health authorities. Provide expert opinion in clinical case discussion and diagnostic dilemmas, develop and validate new diagnostic methodologies and assess in the clinical labs, lead national and international research project in the laboratory diagnostics, final authority on issuing and amending reports, and the relevant specialty can establish a highly equipped indigenous laboratory facility with the routine and special analytical facilities with the relevant reporting authority, will act as a Dean HOD principal of any AHPC accredited institute to teach undergraduate and postgraduate courses in the respective disciplines, design, update, and lead curriculum development and course planning, supervise masters and PhD students in the research and dissertations. उसके बाद है evaluate students through the practical assessment viva etc. Ensure quality assurance in the testing methodologies and the academic delivery. Conduct high quality independent and the collaborative research. Publish in the reputable national and international peer reviewed journal. Secure and manage research grants and projects. Present research finding at conference uh, and SYMPOSIA. Guide research teams including junior faculty and students, serve as the coordinator or the head of the specific academic programs or the committees. Participate in the strategic planning and policy making within the department. Mentor junior faculty, assistant professor, and lecturer. Assist in the accreditation, quality assurance, and the academic audits. Organize and lead workshops, seminars, conferences, or the public outreach initiatives. Engage in the national and international collaboration. Serve as the peer review editorial board member and the conference organizer. Attend faculty department program, virological training, clinical workshops, contribute to the community health initiatives and interdisciplinary projects, participate in the clinical trial, and can eventually become a principal investigator or lead a clinical research study with relevant experience and training required. Limitation and summary. Medical laboratory professionals are non clinical healthcare practitioners who specialize in the laboratory diagnostic. They do not prescribe medications and diagnostic tests, do not perform or report histopathological examination or bone marrow procedures, focus exclusively on laboratory based analysis and support for the clinical decision making, authorization for the private laboratory and blood bank operations. Medical laboratory professionals with higher academic credentials may operate private laboratories under the following conditions: stat lab, collection point, or blood bank. Independently operate by registered medical lab technologist having 5 years of experience with MPhil or MS degree in the relevant field of MLT, must possess a basic degree in the medical laboratory technology. फुल रेंज क्लिनिकल लेबॉर्टरीज में है ऑपरेबल बाय PhD holder in the relevant field, must possess a basic degree in the medical laboratory technologies, specialized procedures, histopathology, Bone marrow must be conducted in the presence of a qualified hematologist or the histopathologist. These are the scope of practice for the medical laboratory technologist. I hope this video is very helpful for you. Keep me remember in your prayers. Allah Hafiz.